we would like to introduce you all to the organizing chairperson of this CME, Dr. Ajay Ovhal sir, Head of the Department of Dermatology at VDGMC Latur. Sir has 20 publications in international and national journals. He has also received some prestigious awards like Dr. Arvind Lodkar Award in 2008 for excellent work in thesis. Sir is always eager to learn and teach something new, and today's CME is a live example of the same. He aims to provide state-of-art skin treatment to his patients. So I would like to invite Dr. Ajay Ovhal sir for enlightening us on basics of threads.
Very good morning to all of you and welcome here for this CME and hands-on workshop on Botox and threads. After this excellent session on Botox by Dr. Disha and Dr. Dattatreya Sonone sir, I will be opening this next session on introduction of threads. So as we were discussing, knowing aging of face is important because facial aging is an intricate process involving interrelated changes to all the structures like bone, muscle, subcutaneous fat and skin. So it is characterized by 5 Ds, mainly deterioration of skin tone and texture, deflation due to loss of bone and fat, descent of soft tissues, disproportion due to hollowing or hypertrophy, then dynamic discord or loss of balance between interacting muscles. So for reference, I have mentioned some age-related changes like tear trough deformity, prolapse, orbital fat, then malar bags, marionette lines, we just saw, and the jowling. Jowling is loosening or drooping of the skin. So what is the relevance of this cosmetic procedure? This graph depicts that the trends of cosmetic procedures from 2021 to 2030. So there is increased awareness for anti-aging treatments due to social media, and there are increased inquiries for cosmetic procedures. We as a dermatologist have different options, and there are some minimally invasive methods. Now most of us are going to practice platelet-rich plasma, mesotherapy, and today's session includes botulinum type toxin A injection, and I will be discussing the PDO lifting threads that are called polydioxonone threads. If these methods are not sufficient, patient can be referred to plastic surgery. The goal of this lecture is to explore facial anatomy, which is in relation to thread lift, and to describe the basics of threads. So facial anatomy, layers of face, these are characterized by concentric arrangement. In the form outward to inward, we can see number 1 to number 5 as skin, then 2 is subcutaneous tissue, third layer important to us today, that is superficial musculo-aponeurotic system, then retaining ligaments and deep facial nerve. Just to be more precise, in this vertical section, we can appreciate outermost layer of the skin, then subcutaneous layer. This is temporoparietal fascia or SMAS layer, followed by deep temporal fascia muscles. Here I want to mention that face has characteristics that different areas of face have different arrangement of layers. Here in temporal area, skin, subcutaneous tissue, and there is temporoparietal fascia. But in zygomatic and cheek area, we have skin, subcutaneous tissue, and then smash layer, which then disappears in neck area, where this smash layer gets converted into platysma muscle. Subcutaneous fat is positioned into multiple independent anatomical compartments. Subcutaneous fat, it gives volume to the face, and fibrous retinacular cutis provides support to the face. It has different compartments. It is easy to remember. The forehead has central forehead compartment, then middle and lateral temporal cheek compartment, the nasolabial compartment, then superior jaw and inferior jaw compartment. In the orbital area, superior and inferior orbital compartments, lateral orbital compartment, and in the cheek area, medial cheek compartment, middle cheek, and again lateral temporal cheek compartment. So again, the structure of concern today, retaining ligaments. These retaining ligaments, these are like a tree where the trunk represents the attachment from periosteum of the facial skeleton, and these retaining ligaments, these are attached from periosteum, they directly insert into the dermis. This ligament pass through all the soft tissue structures, panning out as multiple branches through smash layer to eventually insert into the dermis. Retinacular cutis, the ligamentous component in subcutaneous layer is called retinacular cutis. Retinacular cutis is not uniform. It is dense at location of retaining ligament and support overlying soft tissues. It forms boundaries that make compartments of subcutaneous fat. In subcutaneous compartment, overlying smash space fibers are less dense and horizontally oriented. Here we can appreciate near the periosteum, these are strong, then they get branched here in the subcute layer in the form of branches. Now superficial fat compartments, these are formed by extension of retaining ligaments into the subcutaneous layer. Different names are given. Superior temporal septum and inferior temporal septum. We should know these names of ligaments because while inserting threads, we are going to pierce some of these ligaments to tighten the subcutaneous fat and support the tissue. Orbicularis, retaining ligaments surrounding the eyes, then orbicularis retaining ligament, superior cheek septum, or it is also called zygomatic cutaneous ligament. This structure is masseteric cutaneous ligament, and along the mandible there is mandibular septum. You might be getting confused with ligaments and septum. Basically, they are all thickening of the retaining ligaments. Only difference is that two ligaments like zygomatic ligament, masseteric ligament, and mandibular ligament, you can see here, these are directly getting attached from periosteum to the dermis. So that's why they are called true ligaments. Whereas the septum, superior, temporal, and inferior septum, these are not getting attached to the dermis, so they are called septum. They are always part of ligaments only. Now the important structure, superficial musculoappuloretic system. Basically, it is a tissue sheet of collagen and elastic fibers, and fat cells. It is extending from neck up to the temporal area over here. So it extends from neck, that is platysma, into the face, temporal area, and medially beyond the temporal crest into the forehead. So it extends from neck area up to the temporal area, and we can say anterior to the tragus. So what is SMAS? The figure below shows us that SMAS consists of a network of small fibrous septi that traverse perpendicularly between fat lobules to the dermis and deeply to the facial muscles or periostea. This mass is called temporoparietal fascia. In the zygomatic and cheek area, we have already seen this figure, but once again to show the mass, I have taken this. So this layer in zygomatic area, this mass is prominent. Again in cheek area, mass is prominent, and it again disappears in the neck area. So anterior to the nasolabial fold, the innervation of perioral musculature becomes more susceptible to injury as the mass becomes more fibrous and divides to form an investing fascia of the zygomaticus muscle, making it difficult to dissect. So generally we avoid crossing the nasolabial fold because here mass disappears to getting invested into the muscle. So muscles we have extensively discussed in the Botox session. The muscles of facial expression are unique and fundamentally different from skeletal muscles beneath the deep fascia because they are situated within the superficial fascia and they move the soft tissues of which they are part. Here, SMAS acts as an amplifier for the muscles. The expression of action of muscles, it gets amplified and it gets exhibited in the form of expressions. All muscles of facial expression have either all or the majority of their course within the layer 3, which we have seen, and they are predominantly located over and around the orbital and oral cavities. Blood supply, again to revise, mainly external carotid branch facial artery, 4 main branches. It emerges at mandibular angle, then superior and inferior labial arteries, then lateral nasal artery and angular artery. The two arteries here, supraorbital and supratrochlear arteries, these are branches of ophthalmic artery which originates from internal carotid. Other blood vessel of concern is superficial temporal artery, which is again a branch of external carotid. Nerve supply, trigeminal nerve, which is a sensory nerve, and facial nerve is motor nerve. Facial nerve branches, they lie inferior to the zygomatic arch and they are deep to SMAS, so we are not going to disturb these nerves. Now coming to threads, we are going to discuss these following points. So threads are commonly used in a procedure known as thread lifting or thread rejuvenation. It is a non-surgical facelift technique that involves the insertion of fine threads into the skin to lift and tighten sagging areas. These threads can be made up of various materials such as polydiazone or poly-L-lactic acid. So mechanism of action is simple. As this picture shows, various cables are holding this heavy bridge. So these threads provide anchoring effect due to tissue adhesion around the thread lifting effect. As threads are introduced in the dermis, they cause mechanotransduction reaction. So what is mechanotransduction reaction? When a foreign material is introduced in the dermis, there is stimulation of collagen due to presence of foreign material. That's why there is increase of blood flow and increase in metabolism, as seen in second image, where there is angiogenesis and increase in collagen. It also causes lipolytic effect and cellulite reduction. What happens when threads are inserted? The picture depicts how threads are inserted in the dermis. They are inserted via needle or a cannula, and the cannula is removed, leaving the thread behind. The thread stimulates the body to make new collagen. There is two-stage effect. Immediate effect due to mechanical properties of thread, and secondary vector of pull, that is lifting effect due to fibrosis formed by the thread. There are many benefits of thread lift, like it is a scarless procedure, it can be performed under local anesthesia, it has very low downtime, patient has minimal discomfort, and there are minimal complications. There are instant results which last up to 18 to 24 months, and there are almost no side effects. There are different thread materials which are commonly used, like polydioxanone, polylactic acid, polycaprolactone, etc. Actually, these are absorbable surgical sutures. They are biocompatible, safe, hydrolyzed, and they are eliminated within 6 months to 24 months. These are types of thread. First one is called monothread. It is a smooth thread because it is without any projections or it is without bars, and it is placed into face in like a mesh-like fashion, and it is used for skin tightening effect. This is normal thread, it is also called monothread. Second one is screw thread. Why it is called screw thread? Because one or two threads are intertwined together around the inserting needle. These are used for giving volume effect on sunken areas. Tornado threads or multi-screw threads, these are used when stronger effect is required, and they are used for general facelifting. Now, most important, which are we will be using it during our hands-on session. These are cob threads. You can appreciate these excretions or projections. These are called barbs. So these are like monothreads, but difference is only these barbs are present over these cob threads. These projections, they help to hook the underside of the skin, jawline lifting, and they cause slimming of the face. Now, important to understand the concept of placement of thread. This figure, here the threads are placed in dermis, and second figure, here the cob threads, they are placed in smash. Similarly, we can appreciate in this left side figure that these threads are placed in dermis and this thread is placed in smash layer. There are different indications. That's why these threads are called versatile. As you explore, you get new indication. It can be used for frown lines, then even for crow's feet, nose restructuring, nasolabial folds, chin lift, marionette lines, smoker's lines, cheek augmentation, as well as it has been used for breast lift, then butt lift and knee lift also. So who are the right patients for thread lifting? young or mature patients who do not want to undergo surgery and have loose or saggy skin. Results are not as dramatic as surgical procedure, but are good in selected cases. Patients who only want to maintain youth or beauty by non-surgical means are right patients. Here a flow chart is given where, depending on the skin type, we can select the patients. If patient has very thin skin, those are unsuitable, or very damaged skin, they should not be selected. When patient has soft tissue volume, thick or less facial fat skin, which is aged, these are most suitable, and desired outcome can be achieved. When we want rejuvenation and skin tightening, we can use PDO smooth threads. If mild lift or moderate lift is expected, we have to use PDO or PDO, that is fog or screw threads. And when mild to moderate texture improvement is expected, we can go for PLA or PCA threads. So different types. Sonone sir is going to tell us in detail, and he will also demonstrate us what are these types and how to put the threads. So thread lift procedure essentially involves consultation, preparation, marking the treatment areas, then insertion of the threads, tissue repositioning, trimming of excess of thread, followed by recovery, and then follow. Now coming to last section, many of us have worries regarding the complication of the procedures. So as per any procedure, there may be localized pain or discomfort, there may be bruising, swelling or infection. Hematoma is very rare. If we are not very well versed with the blood supply of the face, then rarely the needle may hit some blood vessel. It may cause hematoma, but it is very rare. There may be mild paresthesia, dysesthesia, linear bleeding along the thread path. There may be asymmetry and shallow depression of needle tracks. There may be protrusion, extrusion, and migration of threads, which is always correctable. Most of these complications are transient and self-limiting. So conclusion, general consensus is that thread lift procedure is one of the most advanced, minimally invasive and safest non-surgical procedure. By understanding the cause, effect and right procedure to manage the different possible complications, this thing we are already doing today. So what we are doing? We are understanding the anatomy, the different methods, what may be the complications. By understanding this, a practitioner can safely deliver the best results in patient using these threads. So thank you for your patient listening.